My name is Ian Bostock. I am a master's student at Indiana State University in the Masters of Athletic Training program, and this is my reflection video on standardized patients. For me, the standardized patient activity that we did was not only helpful but very informal for, I believe, the master's students that hadn't had the time to be in a clinical field yet. As a patient that had a coccygeal fracture, especially, I saw a lot of different ways to handle a situation, and not only the good ways but the bad ways as well. So getting to see not only how each individual went about performing things, but some of the ways you should be performing things and some of the ways you shouldn't be performing things. It was, I wouldn't say bad the way that some things were presented, but it was also a way of saying, this is how I should be doing things in the field, or this is how I should do something different in the field. Not everyone handles the situation the same. It also helped me see the things that I should be doing immediately: names, getting the age, past medical history, some of the things that were forgotten during those patients, I guess, well, from clinicians' standpoints, from the people. It also helped me see how I should handle some of those things for maybe next year for my own. And then coming back in the afternoon and getting to watch those patients and how everything was different. I didn't get to see everyone, which is my patient, handle my situation. So getting to see how each person handled different situations, from the upper body extremity injuries such as a concussion and shoulder injuries, things like that. And then especially the thing that really got me was how it's going to be important to make bridges with cultural differences. Watching some of the junior class when they were talking to our master students that were from Japan who have some language barriers, it was they were trying to communicate, and watching them do that, and it helped me see that I need to be aware that some people may not have English as their first language. So knowing that I may have to at some point have to figure out how to communicate with a person that isn't a native of like the United States, that may not have English as their first language, finding ways to see and show what I'm going to do, or if maybe they don't understand something, finding a way to make sure they do. The upper body ones were also something that I got to see and really look into, like a concussion. I mean, coming from someone that's had a concussion, I know like what they do, but I didn't know how to go about it. Like I've only, just remembered being a patient, but seeing it from a clinician's perspective, seeing all the things that you should do, making sure the patient's comfortable in every setting, not just when you're done, you're just like, not just ending like, okay, like having a way to enter conversation so that the patient knows that you did your job correctly and just went about everything you could do to make sure you've done your best job as a clinician, to make sure your diagnosis as a clinician is the one that's going to get them to a physician so that they can start the healing process immediately, whether that be in rehab or back on the field doing some sort of activity to make sure they're getting better. Being an athletic trainer isn't just going in and being like, okay, let's just get you to a doctor. It's literally going through things that most people aren't aware of. It's going through tests, ranges of motion, everything you can to make sure that you're helping a patient immediately. Just see if there's anything else you can do, or if you need more help from a clinician or a physician. Just every standard patient that I watched, and the one I was, I got to learn so much from it, and I'm really excited about the opportunity to have not only my own standard patients in the future to go through next year, next summer. I'm really looking forward to all the other clinical activities that will be presented to me in the near future as well.